It's my privilege to be here with you at the 8th World Integrative Medicine Congress held online and at Silicon Valley International Medical University, and of course at the Hotel Shenzhen in Guangzhou. My name is Helen Chunso, and I'm a practicing acupuncturist and herbal medical practitioner in the UK. Many of the cases that I see in my clinic are women that are trying to conceive, and many of them will also be of the older age. So I'd like to share with you some of the benefits that Chinese medicine, and particular Chinese herbal medicine, can have in this group of women. So it's my pleasure to share with you some of the cases that I have seen in the clinic where women over 40 have been able to become pregnant using Chinese herbal medicine and acupuncture. This is of increased significance in the UK, as we've actually come to see that there is a mean rise in the average age of birth. Women are becoming pregnant later and later, and they're seeking to pursue their careers. And we're also seeing a corresponding rise in the birth rate via IVF and assisted reproductive technology. If you can see the graphic here, women are waiting later and later, but their chances of success are not improving with that delay. Could this be because there is a rise in male factor? We perpetually see men who are getting reports back where they show that their volume of sperm is okay, their count is okay, their motility is okay. But we're continually seeing this problem with the morphology being poor. And there's been a downgrading of the sperm parameters since 1980, where the World Health Organization has dramatically dropped the test. These tests are also not seeing in them any DNA fragmentation, which may be implicated in recurrent miscarriage, of which there is a fairly high chance as women become older. As we see, the number of follicles for a woman declines rapidly after the age of about 30, and the chance of miscarriage will come up because the eggs will not be as viable. So this is where TCM can step in. We have the ability to improve the egg quality. We have the ability to improve the sperm. We have the ability to help the tube patency and to improve the uterine environment and the endometrial thickness. And where there is a problem with the blood flow, we can do that for the couple. It was a really great collaboration in the UK, where the Register of Chinese Herbal Medicine noticed a study that was published. This study was called Maternal Traditional Chinese Medicine Exposure and Risk of Congenital Malformations, a multi-centre prospective cohort study. And in this, it stated that it was unsuitable for women to take Chinese herbal medicine, and because there was an increased risk of birth defects. Our academics looked at this study, and we had a rapid response to this because we found that there were several factors within the study that needed to be considered, and therefore there was flaws in the research. And we worked together with the ATCM, and this study was retracted. We published this statement along with the EHTPA, where we defended the use of Chinese herbal medicine in assisted reproductive cycles. And in that study that we critiqued, we found several flaws, and we cited them, and we produced evidence where it was possible to use Chinese herbal medicine to improve pregnancy rates in women over 35, and I include the references here. And this was on the basis of a pattern differentiation. As we know, the strength of Chinese medicine is to work with the individual. So this was used alongside an adjunctive treatment of IVF, and it was demonstrated that there was an increase in pregnancy rates in the women that took that, along with IVF alone. We also cite similar research demonstrating that Chinese herbal medicine can decrease the AMH levels in the follicular fluids, and it is therefore a safe intervention for patients undergoing IVF who have PCOS. In our response, we also cite that IVF and Chinese herbal medicine are compatible with respect to endometrial receptivity and embryo quality, and where patients are undergoing mild stimulation, as is popular in this age group of patients who may have low AMH, the Chinese herbal medicine formula would raise the likelihood of the fresh embryo transfer being successful in a treatment cycle. We think this is important because there is a number of clinics that are offering different options for more gentle and natural and mild IVF. And we think that what we have in improving the number of eggs that a woman will be able to create in an IVF cycle, and the quality, most importantly, of those embryos is improved. We also know that an improved endometrium and an increased endometrial receptivity will support that pregnancy. It's really important that our clients know that taking Chinese herbal medicine 3 months prior to an IVF cycle significantly increases the pregnancy rates. And as we know, follicular genesis will take a minimum of 3 months to undergo. So a follicle that will be used in an IVF cycle should ideally be sufficiently nourished in the 3 months before, because that is the natural cycle of the egg. Chinese herbal medicine taken in the time before IVF will be able to produce increased results. There is an opportunity for collaboration here with IVF clinics who are aware of the research. And I cite some more of that, as the RCHM did in the study provided before. So I'd like to move on to a brief look at how I work in clinic. I make sure that every patient that comes to the clinic seeking IVF, I say that they must do basal body temperature charting and become aware of their cycle. This offers a number of opportunities to the patient because it constructively engages the patient and the partners in observing their own care. It helps us precision time our work if there is an IVF scheduled in the future. So, for instance, where there is a poor luteal phase and or there may be a too early ovulation or a late ovulation, we will be able to see that improve in advance of an IVF. Taking the BBT charting helps a patient become more aware of where she may be in her cycle, so that she knows when to change her herbal prescription as she goes along. And it has the additional benefit of when there is a successful conception, and we see that going forward, that the patient can be encouraged by seeing the retention of the high temperatures in the luteal phase. It's also an extremely cheap way of a woman being able to monitor this, and very empowering. As we know in Chinese medicine, we would treat each of the 4 phases, starting with menstruation to regulate the bleeding and to nourish and invigorate the blood. I always get a patient into the clinic at this time where she has any abnormal bleeding or the bleeding is heavy and painful. And when we've seen that the BBT hasn't indicated that changeover from yang to yin at the start of the cycle, and there is signs of blood stagnation, I would be treating a woman with acupuncture and herbal medicine tailored to this part of the cycle. Equally, when we go into the follicular phase and the period has ended, Chinese herbal medicine, standard forms such as Gui Xiao Di Huan, modified, would be ideal to help nourish the follicle and to clear any heat to prevent the premature ovulation that we see sometimes in women of this age group. Where there is stress, and we're able to regulate the liver and regulate blood, drain any dampness, and aromatically transform it and prepare a woman for the release of the egg. When a woman goes through IVF, it's really helpful if we've seen a thin endometrium that we can improve the blood flow and the thickness of the lining. And formulas such as this taken 3 months in advance will be able to help with those cases. If a woman is having any pain during ovulation or has polycystic ovaries and damp accumulation in the middle, any chi or blood stagnation, I would be treating at ovulation and advising my patients to make sure that they know where that ovulation is via the BBT and the use of urine test sticks and looking at cervical mucus. The couples would be advised to have intercourse every 2 days in the run-up to this time. And in the luteal phase, we will make sure that we were nourishing the body's natural response. So if there was low progesterone on the test, or there was a dip in the basal body temperature chart indicating luteal defects, or if the BBT drops early or rises slowly, we would be seeking to support any possible implantation in this phase. So preparing a warm and stable uterus at that time is what I would do. This has, I've found, been very useful where women have seen that triphasic shift or the temperature is holding high, and she's been doing her charts in advance of this period because it becomes very supportive to see this cycle maintaining itself. And here's examples of the formula that we would use, Yu Gui Wan or Jiangutang or Yulinju. Where there is any phlegm and dampness, I would continue to do that and even consider the use of mild blood regulating herbs where they would be indicated. The case I'm about to show you, there isn't a need to do that, and it was possible just to support the woman. I would say that if there was a problem in the luteal phase after around 9 days, it would be important to strengthen the kidney yang and consolidate the chong mai. The formulas that we've used would be what a patient would be prescribed from the clinic. But the patient would normally be using progesterone pessaries from her clinic. And here's an example of a BBT chart that I used with a lady who had had a previous miscarriage. So you can see there that whilst there is a change in the BBT and there is some rise and fall, overall the pattern is stable and the temperature maintains quite high. This has been very reassuring to a woman who had previous miscarriages. I make sure that dietary support is followed, and most of my patients will be happy to consume bone broth or chicken soup to improve the kidney essence. And most patients are happy to grind or take dietary supplements such as gochita, two-seedser, and undertaking seed cycling as part of their chart. I'm a big fan of two-seedser to support at this time as well as Shuduan. Two-seedser is acrid, sweet, and neutral, and it's an essential herb where the patient has low AMH. I use it at quite a high dose there, 12 to 15 grams. I'd just like to share with you now a case of a lady that I saw who became pregnant, who was over 40. She came to see me in March 2023 last year, and it was a couple of months before she had a positive pregnancy test. She'd had a history of 2 recurrent miscarriages when she came to see me fairly early on at 8 and 11 weeks respectively, and had already had a child. There was some sperm motility issues, and whilst her partner was sceptical of Chinese medicine, he supported her coming to the clinic. And it was very useful to see her basal body temperature charts because immediately I could see through the chart this was a very strong woman with excellent Jing, even though she was older. And it was an erratic chart, and there was a lot of stress, severe anxiety about becoming pregnant. It became clear that supporting her and nourishing her was an essential strategy, but much of what I was doing was soothing the liver. Here is some examples of an erratic BBT chart, and we see on the left, the chart was very sawtoothed and moving like this in March. In April, following cycle treatment, as outlined before, the chart had somewhat smoothed out. And later in that month, in the next month, you can see that in fact the lady ovulated nicely around day 13. We improved the time to ovulation and cleared any empty heat to prevent that premature ovulation, which we could see in the earlier cycle. And she went on to ovulate. And as we can see here, we have what looks like the triphasic shift. And indeed, she was pregnant. She continued to take progesterone that was actually self-prescribed from the internet to support this pregnancy. My treatment principles were to soothe the liver, strengthen the spleen, nourish yin and blood, regulate menstruation, clear heat and calm the spirit in the respective parts of the cycle. I decided that I was just going to try to work with Jiaowei Xiaoyaowan and to really treat the spirit there with herbs such as Herb-1P and Yujin. This lady, I have a picture of a chicken there. She really liked her chickens, and they really kept her happy. She said that going to see the chickens calmed her. She'd enjoy taking walks in the garden. It continued to be part throughout her pregnancy that brought her a lot of peace. In the early phases of pregnancy, my lady took weekly acupuncture. Um, and it was very important for us to come into the clinic. We've all seen patients where they've had previous miscarriages and they're very fearful in the early stages, and having that point of contact where you can demonstrate that they are doing well, their BBT is doing well, the reassurance that you can see the usual signs that you would want to see. I continue to treat her to tonify the kidney and the spleen, consolidate the Chiang Mai, and make sure she was prone to a lot of empty heat. She had took a scan at week 7, and there was a fetal heartbeat seen, and much to her relief. This is an example of the kind of herbs that I was giving her at that time. Often she would become constipated, and sweet cold herbs such as jamu were added to the formula. And the pregnancy, as you can see, um, went on for several weeks, and she ended up being with me till week 12, and to make sure that everything was okay for her, and she checks back in later. I'd just like to take this opportunity to thank you for sharing the case histories. Here's an array of beautiful babies that came into the world with Chinese herbal medicine, with their mums all over 40. I really think that Chinese medicine, working with fertility clinics in an integrated way, has a lot to offer this particular age group who may not share the success that we would want them to without our care.